History of lobotomy. In the 1930s, diagnoses of serious mental illness were increasing, and yet knowledge of its causes or how to treat it was not. Doctors were sometimes willing to try anything to help their most desperately ill patients. This terrible need for treatment cleared the path for widespread acceptance of such radical treatments as shock therapy and lobotomy. Who invented lobotomies? In 1935, at an international neurology conference, Antonio Egas Moniz sat through a presentation on the frontal lobes of the brain and the effects of removing them from chimpanzees. That year, in a Lisbon hospital, he performed a brain operation he called leucotomy. This was the first ever modern leucotomy to treat mental illness, which involved drilling holes in his patient's skull to access the brain. For his work and contribution to medicine and science, Moniz received the Nobel Prize in Medicine in 1949. In 1936, after reading Moniz's publication of successful operations, Dr. Walter Freeman and Dr. James Watts performed the first prefrontal lobotomy in the United States. The psychosurgery was performed on a Kansas housewife, 63-year-old Alice Hood Hammett. That year, the pair went on to perform 20 lobotomies. Freeman is credited for the name change to lobotomy.
What was the purpose? Lobotomies were intended to be a treatment for schizophrenia, manic depression, bipolar disorder, and many other mental illnesses. According to a National Public Radio article, Freeman believed that an overload of emotions led to mental illness and that cutting certain nerves in the brain could eliminate excess emotion and stabilize personality. Likewise, Moniz had an idea that some forms of mental illness were caused by an abnormality in nerve cells, causing neural impulses to get stuck and patients to repeatedly experience the same pathological ideas. So how were they performed? November 1935, Moniz and his assistants made the first attempts at the experimental surgery. They drilled holes in the skulls of patients and injected the frontal lobe with a series of alcohol. After 7 patients, they switched to cutting the lobe with a wire. In this practice, nothing was removed, only connections were severed. During the first lobotomy on Alice Hammett, Dr. Freeman started the surgery by making incisions 3 centimeters in length. Then, using a drill, holes were made in the skull over the left and right frontal lobes. A narrow shaft was then inserted 4 centimeters straight down through the hole on the left side into the exposed surface of the brain. Freeman wanted to find a more efficient way to perform the procedure without drilling into a person's head, like Moniz. Freeman created the 10-minute transorbital lobotomy and performed this surgery for the first time in Washington, D.C. in January 1946. This practice would come to be known as the ice pick lobotomy.
How popular were lobotomies? Egas Moniz and his assistants completed nearly 40 lobotomies by 1937, and the procedure became standard practice, even though it only still had mixed results at the time. The number of lobotomies in the US performed climbed from about 100 in 1946 to about 5,000 by 1949. Freeman was known to complete upwards of 20 lobotomies a day during his career. He would go on to lobotomize almost 3,000 patients, and 19 of them were younger than the age of 18. One of Freeman's most famous and notable patients was John F. Kennedy's sister, Rosemary Kennedy, and it was authorized by their father in 1941 when she was 23 years old and left her entirely incapacitated until she died at the age of 86 in 2005. Were lobotomies successful? Ultimately, they were not. But according to the NRP.org, Dr. Elliot Valenstein said that there were some very unpleasant results, very tragic results, and some excellent results, and a lot in between. A lobotomy was done by Freeman on a woman, Anna Ruth Chanels, who had intense headaches. After the lobotomy got rid of her headaches, he decided he could reach out to more than just the mentally ill. However, it is said that she left the surgery with the mind of a child. Lobotomies are seen now as a disgraceful and harmful practice. However, the removal of specific parts of the brain is still seen very rarely, but still seen in modern science for patients who have had failing results in all other parts of their life.
The effects of lobotomy were widely different for patients, and although some actually seemingly benefited from their surgeries, many were left with negative effects. Lobotomies widely caused a lack of empathy, drastic negative change in personality, and a lack of one's ability to even function on their own. The main long-term side effect was mental dullness, said Dr. Baron Lerner, a medical historian and professor at NYU. Some unforeseen societal effects of lobotomies were that they were disproportionately used against women and the LGBT plus community. At their height, lobotomies were used to attempt to change persons of the LGBTQ plus community into heteronormativity. According to the Smithsonian's YouTube channel, around 40% of all lobotomies done by Freeman were on members of the LGBT community in hopes of suppressing the community. According to Mary Kazal in her writings, Diagnosing Womanhood, Lessons Learned from the Gender Bias, lobotomy was a Nobel Prize-winning medical intervention and yet is probably the most conspicuous example of discriminatory treatment and gender bias in the 20th century medicine. Lobotomies were originally used to try and treat different mental illnesses such as schizophrenia and manic depression. They did this by removing part of the frontal lobe. However, lobotomies had unforeseen side effects on both society and the individuals. Lobotomies removed many people's personalities and could even make them unable to be independent. Lobotomies disproportionately were used against the members of the LGBT community and women.